Welcome again, Dr. Casperson.
Thanks.
In your book, on your podcast, in all of your work, you discuss many misconceptions around women's sexual health, especially in perimenopause and menopause. What do you think are the biggest myths that continue to persist, and why is it important that we dismantle those?
Oh, I think the biggest myth that got me into understanding hormones was, becoming knowledgeable about female sexual health and female sexual, the ecosystem of it. How does it work? How do our bodies work? People kept saying, well, you know what happens with menopause. Well, you know what happens with menopause. And I'd be like, anybody gonna tell me? And they're like, well, you know what happens with menopause. And I'm like, no, I don't know what happens with menopause. Like, what happens with menopause?
Good.
And so, like, that's the biggest myth, is that your sex life automatically gets worse or it gets non-existent. And although that can be true for some, that is by no means universal. And conversely, midlife, perimenopause, postmenopause is actually more of a, I hate to use the word, but it's useful as awakening of like, what do you want? How do you want to feel? What do you want to try? Who do you want to be with? And like, it's actually a very exciting time.
Hmm.
And if we don't address symptoms that arise in perimenopause and menopause, it can profoundly affect your sex life for the negative. So I
Right.
think the myth is rooted in a lot of people's lived experience of like, it actually can be not as great if you don't educate yourself onto like, what do I need to do to take care of mind, body, spirit in midlife?
I love that. I think of that all the time, that perimenopause in particular is this opportunity for expansion and awareness. And I think this sexual piece maybe has, as you said, been rooted and sort of being dismissed. And your work highlights that this is not so at all. So take us to the hormone piece. How do hormonal changes during perimenopause affect vaginal and sexual health? And can you talk about the role of hormone replacement as a way to address these issues?
Oh, yeah, absolutely. So I think, the first place we always have to start is defining what menopause in midlife is. Because again, I think the myth is it's a hot flash and you can no longer get pregnant.
Right.
It's a hot flash and your periods stop.
Yeah.
Right? And realizing those are symptoms of what's happening, but that's not what's happening. Right? That's like a result. You not having periods or getting pregnant or having hot flashes is a result of the ovaries running out of steam, running out of hormones, running out of eggs. And because we are now outliving our ovaries, we have these profound body changes everywhere from skin to brain to bones to genitals to vagina, that happen because everywhere in our body is influenced by hormones. Hormones are simply messengers. They go into our cells, they either act on the cell membrane or they go inside the cell and act in the mitochondria and the nucleus. They're literally like keys that help unlock the full potential of our cells. And that's every cell in our body has hormone receptors. The other big myth about, midlife is that ovaries only make estrogen.
Yeah.
Ovaries actually make testosterone, which then gets converted to estrogen. But if you start off the bat and you're like, what about women and testosterone? They think you're trying to give them something that's male, right?
Right.
Because they don't understand all bodies have testosterone, just in different ratios. In women, in our reproductive years, we have about 4 times the amount of testosterone as estrogen. And testosterone starts going down long before your periods end, but you will continue to make some testosterone even after the estrogen's gone.
Can
So I
I
always
pause
start.
you for a second, just for
Mhm.
clarification purposes? So
Yep.
we make 4 times as much testosterone during our reproductive years. I know that some people are still wondering, are we making less than a man makes, or are we making, what are we making?
Yeah. About 10% of what a man makes,
Okay,
but it's still 4 times the amount of estrogen that you make.
interesting. Okay, thank you.
Yeah. No, it's crazy because we've gendered these hormones and
Yes.
we've done 2 things. We've gendered them, so we put estrogen in these bodies and testosterone in these bodies, and that takes away the importance. Like, men need estrogen, women need testosterone, all bodies need hormones. So we've gendered them. And then the other thing we did is we labeled them sex hormones, which is not true. They work in our brain, they're neurohormones. But when we give them the sex hormone moniker, it's kind of, sex is extra in our society, and sex is not as important as things that work in the brain. And so really emphasizing that these hormones are neurohormones, they're bone hormones. They're not, like, air quotes, just sex hormones. They're made in our gonads, which is why they got that label. But I think it really diminishes their importance when we're like, that's your sex hormone.